You shall see nothing.
Maybe the idea of hypnosis makes you conjure visions of old films like Svengali.
But Svengali.
Svengali.
Just focus on that sensation of floating. That's right.
But believe it or not, yesterday's hocus pocus is becoming an essential part of today's modern medicine.
And you'll notice that when you relax your eyes, tension flows gently away.
In an operating room at Beth Israel Deaconess Hospital in Boston, Dr. Elvira Lang, an associate professor of radiology at Harvard Medical School, uses hypnosis to relax patients who are undergoing minor but sometimes very painful surgery, having blocked arteries, veins, or kidneys open, for example.
Just like some nice warmth moving down the body.
Procedures where total anesthesia is not an option, but local pain medication has its limits, especially with patients who are very anxious.
And you can give those patients as much medication as you want. They will override it. And just send the relaxation down all the way into your leg.
While hypnosis has long been used to help people stop smoking, lose weight, and overcome fear of flying, it wasn't easy for Lang to break through the boundaries of traditional hospital medicine.
When we started it all about 13 years ago, there was a lot of ridicule. We didn't use the H word, the hypnosis. That feels good. That's right.
What are the results of the studies that you have been doing?
Well, what we found with hypnosis was that procedures were more comfortable, safer, and faster. Patients used much less medication, and they had fewer side effects.
Meet 15-year-old Billy White. He was burned in a gasoline fire.
And with every breath you take, you become deeper and deeper relaxed.
At Harborview Medical Center in Seattle, psychologist Dave Patterson is helping him prepare for having his bandages changed.
When you go in for your dressing change, and the nurses start pulling off your bandages, that you'll be reminded of how comfortable you are right now. You'll become even more comfortable, really. Profoundly relaxed.
It can be excruciating, even with the gentlest touch. Did the hypnotism really make a difference when they were doing these painful procedures on you today?
It really did. It's just the pain levels were way down. And
hypnosis has worked so well for burn victims that Patterson obtained an NIH grant to study virtual reality hypnosis. Just before bandage change, patients put on headsets and travel through a three-dimensional canyon where all is cool and peaceful.
Your breathing is slow. We got great results. We now have 15 patients collected, and so far the results seem similar to that which we would get with using live hypnosis.
So far about equal.
So far about equal. You find yourself taking a deep, deep, comfortable breath.
But virtual or live, hypnosis is on the upswing. A recent NIH study now reports that 2/3 of all doctors say they refer patients for hypnosis when they believe it's appropriate.
Your mantra.
That makes perfect sense to psychotherapist Eleanor Lazar, who teaches pregnant women to use hypnosis techniques on themselves during labor.
And while you're in this beautiful, restful, happy place, I'd like you to imagine that you see a rainbow around you. But the unusual part of all this is that the lay population, the mothers themselves, are bringing it to the medical profession. And they're opening their eyes now, and more obstetricians are beginning to see what this is about.
Especially with examples like Jody Donahue. With her husband Larry helping her stay hypnotized, she says it took only 4 pushes before baby Jenna was born in this water tank.
I didn't feel any pain at all.
She was just relax and breathe and
I was on a beach in Jamaica, having my baby in a birthing pool.
And so you're not feeling fatigued at the moment. You're feeling.
And hypnosis advocates like Dr. David Spiegel see the birth of a whole new movement.
I don't want it to be the last thing people think of when they, run out of other things to do. I want it to be the first thing people think about, because it's easy to do, it's effective, and it makes patients feel better about themselves.
You can return whenever you feel ready, and it's all up to you. That's good.